How does interstitial cystitis lead to constant bladder urgency? Imagine feeling like you need to go to the bathroom all the time, even when your bladder isn't full. That's a common experience for people with interstitial cystitis, also called bladder pain syndrome. But how does this condition cause such persistent urgency? Let's explore the science behind it. Interstitial cystitis starts with damage or dysfunction of the bladder's protective lining, known as the urothelium. Normally, this layer acts as a barrier, keeping irritating substances in the urine from reaching the bladder tissue. In interstitial cystitis, this barrier becomes compromised. When it's damaged, substances like potassium and other chemicals in the urine can leak into the bladder wall. This leakage triggers an immune response, activating cells like mast cells that releases inflammatory chemicals such as cytokines and histamine. These substances cause inflammation and irritation of the bladder tissue, leading to swelling and injury. This inflammation makes the nerve endings in the bladder more sensitive. As a result, even small amounts of urine or slight bladder filling can send strong signals to the brain that the bladder is full or needs to be emptied. This heightened nerve sensitivity is called afferent sensitization. It causes the brain to interpret normal bladder sensations as urgent, leading to the frequent urge to urinate that many with interstitial cystitis experience. Chronic inflammation also causes changes in how the nerves in the bladder process signals, a phenomenon known as neuroplasticity. These long-term changes make the nerves even more responsive over time, intensifying feelings of urgency and pain. Additionally, ongoing inflammation can reduce the bladder's capacity by causing scarring and thickening of the bladder wall. When the bladder can hold less urine, the sensation of needing to go becomes more frequent and urgent. From a neurological perspective, the brain's centers that control bladder sensations, such as the periaqueductal gray and the pontine micturition center, receive amplified signals from the irritated nerves. This increased input triggers the brain to send urgent signals to empty the bladder, even when it isn't full. In summary, interstitial cystitis causes constant bladder urgency through a combination of factors. Damage to the bladder lining allows irritants to penetrate and inflame the tissue. The immune response releases chemicals that sensitize nerve endings. This lowers the threshold for bladder sensations, making normal filling feel urgent. Long-term nerve changes and scarring further heighten this sensation. Understanding these mechanisms helps guide treatment strategies aimed at reducing inflammation, protecting the bladder lining, and calming nerve signals. While interstitial cystitis is not a cancer risk, managing inflammation and maintaining bladder health are key to improving quality of life. Always consult healthcare professionals for personalized diagnosis and treatment options.